You're watching a special edition of the Wellness Hour, the leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. If you are missing one tooth or all of your teeth, and especially if you have a loose denture, my advice, stick around. This edition of the Wellness Hour.
The Wellness Hour, an in-depth discussion with today's top physicians and medical leaders. And now, your host, Randy Alvarez.
You're watching the Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic, what you need to know about dental implants. With us, we have two periodontists, Dr. Heller and Dr. Versman. Dr. Heller, welcome to the program.
Thanks for having me.
Dr. Versman?
It's a real pleasure to be with you today, Randy.
Now, before we get into today's topic, dental implants, tell me a little bit about your practice.
Love to. We've practiced in the Aurora area for over 30 years, Randy.
Okay.
Specializing in periodontics. Periodontics, as you may know, is one of the 7 specialties in dentistry.
What is it, by the way? What is that specialty?
Well, the design of periodontics is to save the natural teeth. And unfortunately, as time has gone on, many of patients lose their teeth, and so our focus has become on replacing teeth with dental implants, which are just new biological wonders that work terrific for patients.
Okay, Dr. Heller, now by the way, you're both periodontists.
Correct.
What's your role in the practice? I mean, do you do the same stuff?
Yeah, basically we do the same procedures. We take care of people. We're doing implants all the time. It's something that we do other forms of treatment as well. But
like what?
Well, in the past we've done a lot of cosmetic, treating gum disease, cosmetic treatment. But what's really nice now with implants, we can remove teeth and put teeth in almost at the same time. Okay,
now your background and training. You both teach, you're professors. Tell me about that.
Well, it was interesting. When I first came to town, Randy, I came into the practice. Dr. Versman had been there for a long time. I started the kind of at that time, and I really didn't have any people to treat. You know, I had all this good knowledge. I went to school. You learn a lot about implants, a lot about dentistry, and I didn't have any patients. So what I did at that point was I started at the school teaching some of the undergrad students, the dental students.
Yeah.
And I've continued that throughout the years, even to this day. I go once a week, one morning every week, and teach in the perio department, doing surgery, dental implants, and whatever else is needed over there.
Okay, so I understand this correctly. The periodontist places the implant, the titanium root in the mouth, and then you have another dentist, like a general dentist, that will put the tooth structure on.
That's how we do it. In our office, we've had the opportunity to work with some wonderful dentists who are really great at what they do. What really our expertise is in the surgical phase. And so it's nice. It's really great for the patient. They get the opportunity to see us to do the actual placement of the dental implant, which is really kind of a benign procedure.
Okay.
And then they get the opportunity to work with their general dentist, whose expertise is doing the cosmetics. So the beauty of it, Randy, is they get the benefit of everybody's expertise.
Now, do people need to see or get a referral from their general practitioner, general dentist before they see you, or can they call you directly? How does that work?
A lot of our patients, Randy, they are referred by referring dentists who want us to place those implants, but many of our patients call directly, and we're very happy to see them and to work with their dentist or to refer them to some of the high-quality people that we have the opportunity to share responsibilities with. And so it's great.
It's also interesting, too, because we do get patients that will send their friends or family, and that's always nice as well, because we get the opportunity to help them.
Now, you don't look like a dentist especially.
Well,
did you always know you wanted to be a dentist? I asked that to every practitioner on the show.
You know what? I did.
Is that right?
Years ago, in about probably 9th grade, I had an opportunity to go volunteer as part of our school program, 9th grade.
Okay.
And it's funny because I remember at that point going to down to the dental school for a couple weeks volunteering. I thought I had this great big job.
Yeah.
Really, it was nothing. But the funny part is now that I've been teaching there all these years, I have this recollection of these people there that look so old.
Yeah.
And now I'm miles beyond in age what those guys are.
But I've got him beat, Randy. I wanted to be a dentist since 5th grade.
Is that right?
All my life, practically all my life.
You just knew you want to be that. I mean, you both love this? I mean, you like doing this?
Love what we do. We have a passion for it. We have a passion for the profession, and most importantly, for our patients.
Now, we've invited you on the show to talk about dental implants, and you say, in all areas of dentistry, probably the happiest group of patients. Why is that?
Oh, because we're able to change people's lives, Randy. I mean, I'm telling you, it is so gratifying. People actually walk out of the dental office with hugs because we've been able to give them their self-esteem back, their comfort in chewing. We've been able to give them a beautiful cosmetic smile and confidence that they can chew and eat anything that they want. And
is that right, though? I mean, they're strong, these dental implants. You can chew whatever.
Unbelievable. They
Okay.
are so strong. It is something. Let me just give you an example.
All right.
I brought a little model here, and it has 2 implants that help hold in a denture, Randy. I'd like you to pull that off for me.
Okay. Okay, well, my hand, let's see. It's pretty good.
It's pretty good, isn't it?
Is this upper or lower?
That is a lower, and that's where people
So just 2
usually,
implants.
at a minimum, 2 implants can give people stability. They can eat anything they want. I was born and raised in the Midwest, Randy, and corn on the cob is my favorite. And people can eat corn on the cob, they can eat apples, they can do anything.
Actually, it's funny because it's one of the things that they always ask us, can I eat steak? Can I eat corn? Can I eat these things? And you really never realize that they couldn't eat that before. I mean, it's really interesting because we don't think like that. If you have all your teeth, you're able to generally chew and eat whatever you want.
What are the age ranges of these patients that you see?
Anywhere from 16 all the way up to 97. That's the oldest patient.
97. Now, why would a 97-year-old want to go through that process?
Well, because 97-year-old patient that came in that I had opportunity to treat had all of her teeth but broke a tooth and did not want to wear a removable partial. We brought a model to show you. This is a removable partial, excuse me, Randy.
All right.
And it has hooks on it that clasp onto teeth. It tends to weaken the teeth, and it also isn't very cosmetic. And this woman did not want to wear something as obtrusive as this, and so we were able to place 1 implant to replace that broken tooth.
98-year-old.
Unbelievable. And
That's
she's
great.
still doing beautifully. She's about 101 right now and still comes in to see us, and we still get the hugs from her all the time.
I have a 73-year-old mother, and she says to me, you know, I told her I'm going to interview you guys, and she's been in a denture since she's 30, so she's or 28, and she's 73. She says I'm way too old. I've been told I'm too old for dental implants.
Absolutely not.
I mean, is that a common?
It is very common. People don't believe that they may be candidates, that at one time they lost their teeth due to gum disease. They think their gums are weak. The gums have very little to do with it, Randy. It's the bone that holds in the teeth, and almost everybody has enough bone that they can have an implant placed. And the neat thing is, people are overwhelmed how easy it is to go through the procedure.
Okay. What about pain, though? I mean, it sounds very painful.
Pain is just something our patients don't complain about. It amazes me even to this day, as many implants as we've done over the years, that we just don't get anybody complaining about it. It's something that they'll take some ibuprofen.
But is that the #1 fear, by the way? Pain? They don't want to go through pain.
Absolutely. I think that's the greatest fear that keeps people from going to the dentist in general. And I always tell
People
my
don't
patients,
like going to the dentist still. Is that correct?
That is correct, but it's unfortunate because dentistry has changed so dramatically. So today, it is a very comfortable environment, and we work very hard to listen to our patients, to understand what their concerns are, and to overcome those so that they can go ahead and have this treatment, which they will absolutely love for the rest of their lives. Because implants, although not always, not 100%, we expect them to last forever. That's how great
So do they
are.
fall out?
No.
No, on a real...
Any stats on that, by the way?
Yes.
Nationally?
Yes.
Probably 97, 98% success. It's really tremendous.
So what are the different categories of dental implant patients you see?
Well, probably one of the more common ones is the patient that's lost one or 2 teeth.
Okay.
And what's happened in the past, Randy, is they didn't have the options of dental implants, and so at that point they had to go through what we call a bridge or another restoration, where they would do is cut down teeth on the right and left side. They'd grind them down and then glue on teeth on both sides. That was great. Patients liked that. But the reality of it is that they just didn't last. The average studies would show 8 to 12 years of success. And so then it became kind of a snowballing effect in that...
I mean, is that where it starts, by the way? You lose 1 tooth, then slowly things happen?
Yeah, it really can.
Is your hunch or theory, or maybe it's a fact that by losing that one, that or by putting in an implant, maybe you could
I use an
stop that loss?
analogy, Randy, it's like a brick wall. And if you take a brick out of the middle of the wall and don't replace it, then the mortar starts to break. And pretty soon a few more bricks come out. And it does
Is that a
snowball.
realistic comparison, though?
Oh, absolutely.
Yeah,
it is. Okay.
Absolutely, Randy.
Why, though?
And,
Why?
Well, the problem is when you do a bridge, as Doug described, which used to be the ideal treatment and the only really good option before implants, People would get decay under those bridges and lose the teeth. They would have to have root canals. The bridges would break. So today we don't have to touch the adjacent teeth. We can leave that enamel perfect.
Okay.
And so we just put an implant in the 1 or 2 areas where the teeth are missing, and the solid, strong, healthy teeth, we leave those alone. And those teeth then hopefully will last for the rest of that patient's life.
The other beauty is it keeps a 1-tooth problem a 1-tooth problem, so you don't get a 3-tooth problem or a 4-tooth problem years later. Another category, Randy, is the patients that have lost multiple teeth. And so what they've had, what Kenny showed earlier, was the partial denture. And that replaced a lot of teeth. But the problem with that is it's removable. It's got something that goes over the palate. It's not as comfortable. They get food underneath it. They have a difficult time chewing with it, so they take it out when they're at dinner. And it leads to a lot of different issues from a social, psychosocial level. So the beauty is now we can replace the partial denture with 1 or 2 implants, and then they don't have to wear it.
Snowball from happening,
Correct.
as you say.
Exactly, Randy. I mean, that's what we're talking about, because we talked about the bridge and how over time it can fail and lead to the loss of more teeth. Now, unfortunately, a lot of patients, they go to their dentist and their teeth are at a stage where they cannot be saved. It's not worth putting the time, the money, the effort into trying to save hopeless teeth, and so they need to have all their teeth removed, whatever are remaining, and then they need to have either a denture or implants. I brought along something that I really want to show your viewers, Randy, because
So what am I looking at there? What is that?
Well, this here is a normal dentition. It has all the teeth and all of the bone.
Bottom teeth, okay.
And what happens, this is the bottom jaw. And what happens over time as teeth are removed, nature no longer is aware that the bone has to remain, so it starts to shrink and it atrophies.
So the bone shrinks. I just want to make sure I have this right.
Correct.
Because there is no pressure from the teeth on the bone, the bone starts
The
like
bone was
dissolving.
put there to hold the teeth. When the teeth are removed, the bone shrinks. Very similar to when you have a leg in a cast, you take the cast off, your muscles have atrophied. Well, as the teeth are removed, the bone starts to shrink.
Okay.
And over time, we get patients coming in, they have what we call a pencil thin ridge. It is so small, Randy, and the unfortunate part is it exposes nerves in the jawbone and becomes very painful. So where do they keep their dentures? In their pocket, in their purse. They don't keep them in their mouth. It's too uncomfortable.
So is it too late at that point?
Absolutely not. That's the beauty of the implants. We can put in 2, 4, 6 implants. They can have a removable prosthesis. They can have a permanent prosthesis that they don't have to take out. And so that's why it's so rewarding for us to be able to help these kinds of people.
You say the denture wearer does not know what they're missing.
Well,
Elaborate on that.
One other thing before we move on. You know, we've all seen that greeting card with the guy whose face, he pulls his lower lip way up over to his nose.
Oh, yeah.
You know, so cosmetically preserving the bone is a big, big, big
Because what? Your
benefit
face
to the patients.
sinks in.
Oh yeah, terribly, terribly. And so the neat thing about implant restorations is you preserve or recreate cosmetics. You can design the prosthesis to look so natural, not fake. People cannot even tell that these are artificial teeth. And again, these people, they gain their confidence, their self-esteem, and they can go out into the world and act like they did back when they were 25, 30 years old.
Just because they had their teeth back.
Absolutely. I mean, you know
Because they're
what?
chewing and eating and...
You can tell we're enthusiastic about this because it changes their lives for such a positive manner.
And sometimes they're better than their original teeth anyhow.
Well, if it's as good as you say that it is, well, you know, and going into this interview, 20+ million Americans wearing dentures. Why aren't they all doing this?
Because they don't know what's available. We
fair.
talked a little bit about fear. They don't realize that it is very easy to go through this. And we like to talk to patients ahead of time.
So consult, they go in, that's where it starts.
Well, the other fear I think too is cost. They think that in order to replace all their teeth, they got to replace each tooth with one implant. That's just not the case.
Okay.
You know,
we're gonna take a quick break, by the way. It's good stuff. I want to know more about the process. What happens on day one? How does somebody become a candidate? How soon do they find out? Downtime, etc. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Up next, more about what you need to know about dental implants. We'll be right back. You're watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. Today's topic is dental implants, what you need to know. With us we have Dr. Heller and Dr. Versman. Okay, now, by the way, at the break, he says that little pin not everybody gets to wear.
Oh, you know, I'm very proud of that.
That just says ADA.
It says ADA. It stands for the American Dental Association. And both Doug and I have participated and tried to give back to our profession. And I've been the past president of the Colorado Dental Association, but currently I'm on the board of trustees or the board of directors of the American Dental Association, representing 7 of our western states and all of the dentists. And the one neat thing about the American Dental Association, Randy, is that it really tries to give back to the public and to protect the public and to make sure that our people in this country understand what dentistry has to offer and try to give access to those who are in underserved communities. So it's a real privilege to be able to participate at that level.
I'm glad you asked him to, because he wouldn't have mentioned it anyway.
Is that right?
So
Very humble guy. Now, is it true that a lot could go wrong in the hands of an inexperienced dentist? Because you're professors when it comes to dental implants.
Well, I think that that's something that patients,
any dentist can do a dental implant legally. Is that correct?
Legally, in our state, any dentist can do anything that any other dentist does. But we do have specialists in different areas of dentistry.
You're biased? You think that they should go to a periodontist?
Well, we've spent so much of our career learning how to deal with any problems that could occur, how to maximize the aesthetics, how to get the best result you can get. We're not really beginners in the field.
But isn't it more to go to a specialist like you?
Absolutely not. It's basically the same.
It's the same.
An implant, to purchase an implant from an implant company costs the same for all dentists.
So with all things being equal, I guess, they should, is that tip number 1, look for a specialist?
Well, you're bringing up an issue that's kind of strong in our heart, is that implants are real costly, and that's really just not true. These things last for years and years and years, maybe forever, but it's such a cheap solution to whatever problem is there, because you won't get cavities, you don't get...
What if they had bad gums?
The neat thing about dental implants, boy, I'm glad you asked that. You seem to know quite a bit about this,
I'm on a roll
Randy.
today. Thank you. I did a little research about you guys.
Very good. The neat thing about dental implants, people who've had gum disease, which is our specialty, periodontics, the implants are very resistant to gum disease and bone loss. And that's why the success rate is so terrific. Because once the bone fuses to that implant, it's going to be there for almost every patient for the rest of their life.
So if somebody has bad gums, that does not eliminate them from getting dental implants?
Those are great candidates.
Really?
Absolutely great.
Yeah.
The only preclusions would be someone who, let's say, had uncontrolled diabetes, who had some kind of blood disease, but most medical problems are not an obstacle to placing implants. As a matter of fact, those patients benefit tremendously because now they can choose their food, digest their food better, eat all kinds of things that they haven't been able to eat. People forget what it was like.
Do they really?
If they've been wearing dentures, Randy, for a long time, they forget what it was like to chew with their real teeth and to be able to taste the food.
How does it affect taste?
Well, what we're able to do is we're able to remove the palate from an upper denture because the implants are stabilizing it so well that you don't have to have this metal or plastic covering the roof of the mouth. So that exposes the taste buds, and it just makes a world of difference to people.
That's great.
So you don't think, now, and we talked, you say that they don't know what they're missing, that you wish there was a try-in period for denture wears. Well, and they couldn't go back.
That's right. If there was some way we could put implants into a patient's jaw and let them go out and try it for a week.
Do you believe that?
I know that. You talk to our patients, talk to any patient who's had implants. It basically changes their life so much that they would come back and say, okay, finalize it.
Or they wouldn't come back because they'd be so happy.
Now, people are coming from all over the state.
They do.
To get dental implants from you.
Right.
They do. They even come from out of state. And what's really neat about our office location, it's very convenient. It's close to the airport, for that matter. We're right near Interstate 225 and Parker Road, and everybody who lives in the Denver area pretty much knows where that location is. So it's very convenient for people to get to our office. And we are so privileged to have people come from all over to have us help them with their problems.
Is it more men, more women that are coming in for dental implants?
It depends on the situation. No one isn't a candidate.
So fixed, I mean, that seems like what somebody wants the most, something that doesn't come in and out.
Right, and if that's their needs and their wants, typically it would be 6 implants, particularly in the lower arch, and 6 implants maybe in the upper arch to accomplish that. So it's not, like I said earlier, it's not an implant per tooth. It's less than that.
So 6 implants and they don't have to take something out.
6 implants and they do not have to take something out. It's permanent. And boy, do people love that.
Now, you could use your own denture in some cases.
Frequently you can. It just depends on the status of that denture.
But you like to remake them, or?
Well, again, we leave that up to the restorative dentist and the patient to make that decision. What we will always do, Randy, is we will always have the patient consult with their dentist, or we will refer them to a dentist before we start. Because if we're going to be a team, we have to communicate as a team, with the patient being the leader, because the patient is the one who makes the decision as to what they would like to achieve.
Now, you call it a team approach.
Exactly.
Do you work together on cases, or are you referring team approach with their general dentist?
Yeah, we actually have done that as well. So it really depends on whatever is needed in those situations. So yeah, we do work together occasionally. It's not typical that Kenny and I would work together.
But we consult a lot on cases as to trying to determine what's going to be best. So he and I will share our thoughts with each other relative to patient records, sometimes examining the patient together. Usually, one of us will treat the patient totally from our surgical aspect.
Let's take the denture wear for a moment. They go in on a consult. What do they want to know? What are their frequently asked questions?
Well, number one, does it hurt? Okay, that's very, very common. Number two, what does it cost? Number three, what they can expect afterwards. Do they have to go without teeth? Those are
Do they have to go without teeth?
No, that's the beauty of it.
Okay,
that's really the beauty of it. Is that
How soon can they eat food?
Right away.
Yeah.
Right away. Now, they're not eating crunchy, hard things. We ask them to use some good judgment. But our rule of thumb is day of surgery, anything they can cut pretty easily with the side of a fork, they can eat. So pastas and meatloaf and casseroles and eggs.
How soon before they can eat a steak with the right candidate? Denture wear.
You like to eat steak, Randy?
Well, sometimes I like a good steak.
And so do our patients, and that's the beauty. Usually after about a week and a half to 2 weeks, they can eat steak. Now, we're not talking about that real tough steak necessarily.
It's got to be a good steak.
But yeah,
You recommend the good steak.
I recommend the good steak. But you know what? Once these people start being able to taste their food and chew it better than they ever have in a long time, these patients will eat good steak.
We're out of time now, but a few things. You say people go out of their way to keep it a secret oftentimes that they are wearing dentures.
Oh, most people do, Randy. Most people aren't going to reveal to someone else that, even their spouses and their children, they're not going to reveal to other people that they're wearing dentures. But can you imagine being out? See, you have all your teeth. You have a beautiful smile, Randy.
Thank you.
You can't relate. It's even hard for us, other than for patients who tell us their stories. They're out to dinner, something gets, a seed or something gets caught under their denture. It's very painful. They can't take it out at the table. They may be able to excuse themselves and go to the restroom and take it out and rinse it out, but then they have to do that when some other people may be around. It is very embarrassing for these people. Think about the spouse or someone who's in a dating relationship, and they have to take their teeth out at night and put them in a glass. Randy, that is very emotionally difficult. So to be able to help those people, it is just wonderful, and they are forever grateful.
Well, everybody, I think, is afraid of losing their teeth. I mean, I've had a few dreams about that.
Absolutely.
I mean, that your teeth fall out.
Absolutely. But those who've already lost them, they've gone through that fear, and now they keep trying to adjust. Because as I mentioned, once the teeth come out, the bone continues to shrink. And if that bone continues to shrink, the dentures get loose, and they start to flop around. So public speaking, being in social settings, it can be very embarrassing.
Because people are dating today. I mean, 60 is young.
Right, and it doesn't have to be lose all your teeth. It could be some of your teeth, one of your teeth. Because you see people who smile nowadays and they're taking their family photos and real tight lip. They don't show any teeth, don't want to, because they're embarrassed.
You say guys grow big giant mustaches to hide.
Oh yeah, absolutely. They do that, or people will speak with their hand over their mouth. They're afraid that their teeth may get loose, or they're afraid of odors that come from underneath the prosthesis. So socially, it can be very embarrassing and intimidating.
Is this
to
the
people.
future of dentistry? I mean, someday.
Well, the beauty is the future is here. It's there
the future
now.
is right now. This is the future for many, many years to come, and implants have been perfected.
Are there misconceptions about dental implants that you hear as dentists that just go, boy, that's not true?
Every once in a while, we'll have a patient come in who says, well, my neighbor had an implant and had a terrible time with it, and we just scratch our heads. It just doesn't seem to happen if you treat the tissues right, treat the patient right. People do not have terrible difficulty with these.
I've asked so many of my patients how they liked it afterwards. Just about all of them say one of two things. Either they don't even know it's there, or they can't tell the difference between their natural teeth. That's pretty powerful.
We're out of time. Somebody watching this they have a denture or they're missing teeth? What do you say to them, and how do they get started?
Well, the first thing they could do is talk to their general dentist.
Okay.
If they don't have a general dentist, we would certainly be happy to talk to them. But the reality is they just got to go and ask and find out. You know, if you look on the internet today, you can't find a paucity of articles on dental implants. I mean, it's all over the place.
We welcome them to go to our internet site, periodontalhealth.com, and there's a lot of information on implants there, but we invite these people to even just call our office for information before they even come in. If they have some concerns about making that first visit, we invite them to call so that we can give them some information, hopefully guide them in the right direction.
All right, I want to thank both of you for coming on the show. Dr. Heller, Dr. Versman, great stuff. Very interesting. Thanks again for
It
coming
was
on the
a
program.
real honor to be with you. Thank you.
Thank you.
You've been
Randy.
watching The Wellness Hour, leader in medical news and information. I'm Randy Alvarez. If you would like to see this again online, visit our website at wellnesshour.com. For now, I wish you good health.
Thanks for watching The Wellness Hour, the leader in medical news with your host, Randy Alvarez, the authority on health issues.